Hi, my name is Bob Hafner. I'm a nurse practitioner. I'm here to examine Angelica Messina today. I'm going to wash my hands real quick. Um, Hi, can you tell me where you are today?
I'm at Research Medical Center.
And what's your name?
Angelica Messina,
And what year is it?
2017.
All right, Angelica is alert and oriented. It's all right, I probably should be on the camera so you can see me, right?
Yeah.
So, Angelica's alert and oriented. She's in clean, relaxed clothing. She has a neat appearance to herself. Let's see. We'll start with the continuing examination with the skin. She has normal, lightly tanned skin from recent sun exposure. Scattered on her arms, she has flat macules approximately 1 millimeter in diameter. Scattered across her arms, they're all regularly shaped in a somewhat circular pattern. In appearance of normal freckles. They tend to come out a little bit more with increased sun exposure. Let's see. Let's go to the scalp. We'll look at the hair. She has even distribution of hair all over her head. There are no nits or debris in her hair. Looking at her face, we'll look at her. We'll start with the skin touch movement. So, can you feel me touching your face?
Mm-hmm.
Good. Everything there.
Mm-hmm.
All right. I want you to move your jaw side to side. Good. Up and down. Good. All right. I want you to clench your jaw. Good. And feel the TMJ, and there was no clicking in that. I can feel the master when she clenches, and there is just a slight tightness to that. All right. We'll look at the eyebrows. She has normal growth of hair over each eye, even distribution. Her eyelashes are evenly distributed with long lashes. I'm going to look in the eye here. She has clear, moist conjunctiva and white sclera. Good. You can look straight ahead. There we go. All right. Moist mucous membrane to the eyes. We will look at her visual fields next. I'm going to hold fingers out. I want you to look straight ahead. I want you to tell me how many fingers I'm holding.
2, 3, 2. I looked.
Look straight.
Sorry.
That's okay.
2.
Good. All right. I want you to follow the movement of my finger without moving your head, just with your eyes. Angelica can follow my finger with her gaze. All right. Keep your finger good. No nystagmus is noted. All right. She has normal eye movements. EOMI, extraocular movements intact. We're going to look at her nose real quick. She has a symmetrical nose. She has dry mucous membranes, normal hair without any discharge. Her mucous membranes are pink. She has normal ears with normal curved auricles. Her ears are symmetrical on both sides. She has piercings in each earlobe, a single piercing in each lobe. Otherwise, no obvious deformities. All right, we will examine her lymph nodes. So I will check her pre-auricular, post-auricular, occipital, superficial, deep, submandibular, tonsillar, submandibular, submental. We'll check supraclavicular. Sorry.
Okay.
It's your clavicle. Yep. So, yep. There we go. And then for clavicular, sorry, supraclavicular, infraclavicular. Let's see. Check the lymph nodes. All right. I want you to turn your head to the left, turn your head to the right. The sternocleidomastoid is good strength to resistance. Show your shoulders. Good. Normal shoulder strength. All right. That about does it for the upper part of the body. Let's look at the mouth real quick. All right, we have our oral mucosa is pink. Under the tongue, frenulum is intact, and she is well vascularized. Say ah.
Ah.
All right. Without tongue compressor, I see her uvula. Her tonsils are gone, so she has, normal fossa there. Wiggle your tongue side to side, good up and down, and protrude your tongue. There you go. Stick your tongue out, I should say. So she has normal tongue movements. So we have covered the eyes, ears, nose, and throat. Looking at the outside of the throat, she has a midline trachea with no deviations. Go ahead and swallow for me. Good. All right. We'll move on to examination of the chest and torso. Go ahead and say ah.
Ah. Ah.
She has normal tactile primitus. In terms of, I'm going to palpate over her torso for any tenderness or abnormalities. She does not have any tenderness or pain on her chest. I will auscultate her lungs. She has deep, even breaths that are unlabored. Her chest rise is symmetrical and smooth. There's no obvious sounds. Now listen, slow deep breaths. Alright, I'm going to auscultate on the back. Start at the top at the apex of the lungs. Listen for one full inspiration and expiration. Left to right. Down. Lung sounds are cleared auscultation, both anterior and posteriorly. There's no obvious crepitus following palpation of the chest wall either. We'll listen, examine the heart. I'll listen to S1, S2, which is a love-dove sound. S1 is best heard apically, and S2 is best heard in the bass. And I'll follow the left side of the sternum down the chest. I'll listen to the apical pulse, essentially find the bottom of the sternum, go over about the 5th intercostal space. Find the PMI. Listen for 1 minute. I hear a normal S1, S2, love-dove, love-dove. There's no clicks, gallops, rubs, or murmurs. Alright. Let's see. Do some percussion on the back of the chest. I'm checking for hyperresonance, which would be indicative of like COPD or restrictive airspace disease, or I'm checking for dullness, which would indicate consolidation or infection and possibly empyema or pneumonia. I'm going to ask Angelica to go ahead and lay flat for me now. move on to my abdominal exam. Lift your shirt up for me a little bit, please. Thank you. She has a symmetrical abdomen. Her umbilicus is normal. She has an innie belly button. Normal movement of the abdomen with normal respirations. No obvious distension. I'll begin with auscultation. I'm going to listen to each quadrant, starting left upper to right upper, down to right lower and left lower. I'm going to listen for vowel sounds in each quadrant for 1 full minute. And she has normal vowel sounds in all quadrants. We'll then do some light palpation. Any pain?
No.
Okay. I'll do some deeper palpation. No organomegaly, no masses. Underneath the right rib cage, I'm going to feel. I cannot palpate the liver, it does not extend below that. I'm going to have you take a deep breath and exhale. I feel just below her ribs and feel the pull of the kidney with exhalation. And then on the right side, and exhale. Good. All right, normal kidneys. I'm not able to palpate the spleen at this time. All right. Go ahead and check her skin and peripheral vascular at this time. So moving over to her legs.
Might have to move that thing. I don't know if it matters.
There we go. So looking at her legs, she has no obvious edema. We'll go ahead and check pulses while I'm here. So we have our dorsalis pedis, our posterior tibialis. I'll check her popliteal pulse and check her femoral pulse. On the upper extremities, I'll check a radial pulse. I'll check a brachial pulse. And I'll check a carotid pulse, just checking one carotid pulse at a time. Good. All pulses are strong, not easily obliterated. Hair growth on her legs is, she recently shaved, so I can feel a very fine stubble, but is evenly distributed on both legs all the way down to the distal part of the calf. We'll examine her muscular strength at this time. Can you pull your toes towards you? Good. Push away. Good. Lift your right leg. Sorry, that was your left leg. Lift your right leg. Good. All right. Both legs and feet have good strength against resistance. Go ahead and grip both my hands at the same time. Good. Raise your arms up. Good. And push your arms down. Good. Both arms have good resistance against, or good strength against resistance. And looking at the shape of her muscles are symmetrical bilateral. She has normal contours of the arms and the legs. I'll have you sit back up, please, Angelica. We'll check your reflexes. So I need you to put your hands on your, there you go, nice and relaxed. First thing I'm going to check is our biceps. So I put my thumb right here on the biceps tendon. She's nice and relaxed, and then I would hit, and we see that she has the proper reflex. The next is I can check the brachioradialis. So put my hand right here, and we're hitting the nerve here, and what we should see is flexion of the, or extension of the thumb. And then here I'm going to hit the tendon on the back here. Go ahead and relax your arm. There you go. Yep, sorry about that. And we can see movement as well. So we have covered the biceps, triceps, and brachioradialis. We will do the popliteal next. Sorry for my boot. So I'll find just below the patella, and you should see slight extension of the, you can't really see in this. Yeah, that should do it. So just below here, and then we're looking for just a little bit of extension of the foot. We will also check the Achilles reflex. So I support the bottom of her foot here, and then I will tap the back. There we go. We'll check her Babinski's response in a normal adult. As you pull along here, we see the flexion of the toes as they curl towards the dull, pushing along the bottom of the foot. Abnormal response would be as if those were flexed. In adults, that's abnormal. In infants, that's normal. So we have checked those. Let's look at her fingers. There's no clubbing of the fingers. She has normal shape of her fingers. She has brisk capillary refill. I can't check the nail beds because of the fingernail polish, but the tips of the fingers do have brisk capillary fill, less than 2-3 seconds. And her skin turgor is very brisk, returns to normal very quickly, so she's well hydrated. And yeah, we'll check her. Couple things left. We're going to check her sharp dull response peripherally, and then we'll check some proprioception and her some other neurological assessment. So just tell me if you feel I got a Q-tip and the end of the Q-tip. Yep, close your eyes for me, please. Just tell me sharp or dull.
Sharp. Dull. 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 Sharp. Dull. Sharp. 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 Dull.
Okay, let's do it on the hands. Same thing. Keep your eyes closed.
Sharp. Dull. Sharp. Sharp. Dull. Sharp. Sharp.
I'm wondering about
I
you.
think I was wrong on something.
All right, I'm going to put an object in your hand. I want you to go ahead and tell me what this object is.
Close my eyes.
Close your eyes, yes.
Pen.
Good.
Wallet.
Yep, very good. All right, so we got that. All right, next thing I'm going to have you do is I'm going to have you stand with your feet together. I want you to close your eyes. And we're going to watch for proprioception. In a normal adult, there's generally a little bit of swaying when they close their eyes because their eyes help us maintain our balance, but this helps us to assess the middle ear and in terms of her balance. She has good balance. She's not falling down yet. Go ahead and have a seat. And I think, let's see, we covered eyes, ears, nose, throat. I covered your heart, covered your lungs, covered your abdomen, covered your eyebrows, eyelashes. Let's see, I covered your muscle strength, your muscle tone, muscle appearance. Covered your cardiovascular response. You know what? Good enough for government work, right?
Do what?
Good enough for government work, right?
That's right.
No, that's good. All right, thank you.
Good.